Hi, everybody. Aki Smith here, founder and executive director of Hope for Stomach Cancer. Thank you so much for being here on this amazing webinar with amazing patients about speaking out and finding the right resources in your stomach cancer journey. So before we begin, I just quickly want to share our vision, which is to bridge the gap between research and patient care. I also kind of wanted to share some of the free resources that we have. We have a Hope in the Bag, which is a free patient navigational kit. It comes with NCCN guidelines, a binder, and other valuable resources. We also have monthly support groups with guest oncologists and guest surgeons, so please sign up for those. We have a closed private Facebook group called Stomach Cancer Support FB.org. We have Hope webinars and newsletters. Thank you.
The night I got diagnosed, I started Googling, treatment centers. I had 3 consultations with 3 separate gastric surgeons. And the first 2 really kind of gave me the standard picture of, well, you're going to need 4 months of chemo, then your entire stomach removed, and then 4 more months of chemo. And so, they weren't too familiar with seeing very early stage gastric cancer. And fortunately, my 3rd consult was with Dr. Sam Yoon in New York City, and he is familiar with seeing early stage gastric cancer.
Well, I started in my hometown of Quakertown, Pennsylvania, at a local hospital, and I did my first whole treatment of chemo and radiation there before my surgery. And at the first, they were not going to do the surgery because I was stage 4. For the surgery, we got 2 different opinions on, who would do the surgery.
3 opinions.
3.
And the 3rd one, the surgeon said he would do it.
And we finally decided to go at University of Pennsylvania in Philadelphia.
Yeah, once I went to MD Anderson, and they said that with the testing they'd done, I was a good candidate for immunotherapy. Just the medication itself is like upwards of $10,000 a month, and I think the billed amount was like $39,000. It was just so inaccessible. Even though my doctors recommended that as a treatment, they would not cover it by insurance because there wasn't enough data or research to support that it would help someone my age. But the way I was able to get the medication was the manufacturer of the drug, they have a patient assistance program. And it was basically me applying for that. They were able to provide me the medication at no cost, which has been, I'm still on that program. I'm still receiving it through them. And that's been, honestly, that's actually saved my life.
Since she was so young, it was hard for us to get into any clinical trials, to get into any specialists, because you gotta be an adult, and she was just not quite there yet. There was tons of these amazing doctors, and they wanted to help, but depending on their specific hospital or the parameters of the trials, their hands were tied. They couldn't do anything because she wasn't old enough. And I watched her fight so hard, and when you feel like your 16-year-old is fighting harder than the system in general for her life, then there's a real big disconnect and kind of failure there.
During the 4th FLOT, I was working really hard to get myself HIPEC, which is where they pour the heated chemotherapy medications. They pump them into your abdomen. And I was able to do so after getting a lot of pushback from oncologists saying there's no proven benefit. It could give you, there's more risk than benefit, like it can damage your organs. It's a newer therapy, and I know there's a lot of controversy on it, but I think a lot of the newer studies are showing how it could benefit people with peritoneal disease.
With insurance, I wish if there was one thing I could change, if it's 4th stage, just go right to immunotherapy. I had 3 different oncologists along the way say if we could, we would go right into immunotherapy because it's not as toxic as chemo and it's working with your own immune system. But I was like, well, then why can't we? because insurance won't let you.
Hello, and thank you for joining us. I am Tom Smith. You are coming in with us on Speaking Out, which is a navigational tool for patients, by patients, for those facing stomach cancer. We have a panel of stomach cancer patients who have graciously volunteered to share their stories to make your stomach cancer journey or your loved one's stomach cancer journey a bit easier. So we have a number of questions that we're going to go through, and this is going to be really informal, casual. Try to keep it as conversational as possible. But without further ado, I think we can start introducing our panelists and getting underway. All right, everybody's getting their cameras turned on. We sort of had a rehearsal. And now, guys, the whole order that we had planned on is a little bit jumbled up. So here we go. First off, a quick thanks to all the panelists. We have Rachel Orth, Camilla Rowe, Suzanne Ottinger, Jason Diaz, and Irasema Chavez. So this, again, we're picking this up on the stomach cancer journey from the point of, if you're watching this, you or a loved one has been diagnosed. So these are all stomach cancer patients. I'm not a stomach cancer patient. My name is Tom Smith. I am Aki Smith's helper and husband, and Aki's the founder of Hope for Stomach Cancer. But let's start with Rachel Orth. And Rachel, if you have any particular questions for Rachel, I believe Facebook is going to be her preferred method of communication. But let's hand it over to Rachel, and she can give her perspective on where she is now, and hopefully that'll help you.
Hi, my name is Rachel Orth. I am 34 years old, and I have been living with stage 4 gastric cancer now for 2 years. I was diagnosed in December of 2020. And I have gone through first line of treatment, which was FLOT chemotherapy. And then we reassessed and I pursued clinical trials. I have been on a phase 1 clinical trial now for just over a year, and my scans have been stable. So I'm happy to be here and share my experience that I can.
Okay.
My name is Camilla Rowe, and February this year, I was diagnosed with a stage 4 recurrence to the peritoneum. I did the standard FLOT, I did Optivo, and I pursued HIPEC, which is a regional therapy, a newer therapy, and scheduled to do my third HIPEC on the 23rd of this month. So just in 9 days. So we'll take it from there. And I guess it just kind of depends on what they find. But currently I am no evidence of disease. So I'm very, very thankful to such a successful response to the FLOT and Optivo, and for HIPECs that I was able to receive.
Thank you. And next is Suzanne Ottinger. Suzanne's preferred social media platform to connect on is Facebook. Suzanne, please take it away.
Hi, my name's Suzanne, and I was diagnosed with stage 4 diffused adenocarcinoma 15 months ago, September of 2021. My metastasis is in my skeleton. So I'm on Opdivo, and I did 8 rounds of Folfox and Xgeva, which is a monoclonal antibody for the bones. And then there was talk of putting me on Cyramza and Taxol and taking me off Opdivo, but thank you to the research and the calls that Aki Smith has, I convinced my doctor to keep me on Opdivo and 5FU and just drop the oxaliplatin. So I'm still stable now, and also the Xgeva.
Okay, thank you. And the next is Jason Diaz. Jason likes to connect on Instagram. So Jason, please have at it.
How's it going, everyone? My name is Jason Diaz. I was diagnosed in 2018, originally diagnosed as stage 3. And then after joining a clinical trial, which consisted of FLOT chemotherapy and immunotherapy, Keytruda, really groundbreaking clinical trial at the time. With my response, I was pathology downgraded to stage 2. I am still in remission. I try to be an activist for clinical trials. And like Tom mentioned, you could reach me at Instagram at any time.
Thanks, Jason. And finally, we have Irasema, formerly Partita. Now it's Irasema Chavez, but just to clear that up, because you can find Irasema on either Instagram or Facebook. But depending on if she gets to updating the name and everything everywhere, that's Irasema Chavez now, but formerly Partita. Irasema, your turn.
I thank you, everybody, for having me. My name is Irasema Chavez. I was diagnosed with stomach cancer in 2015 at the age of 34. I had a recurrence in 2016, and I was NED for 4 years. And then in 2020, I was diagnosed with breast cancer. I am currently NED for both breast cancer and 6 years stomach cancer. So I'm just here trying to just continue to inspire people and to have faith along their journey. Thank you for having me.
Thank you, Irasema. All right, so the first of many, or maybe the second or third already of many thanks to all of you guys, our panelists, for joining and sharing your stories. The first topic, and I'm just going to rattle off exactly what the boss, Aki, wants us to cover here. So the first topic is, so you have stomach cancer, now what? All participants, you've been diagnosed with stomach cancer. Right off the bat, did you know what stage? Did you have to wait for staging? So kind of what was the staging experience? What was the staging journey? And then what is the first thing, in your opinion, that patients should do when they're newly diagnosed? So who would like to start that one off? I'll nominate Jason.
All right. So when I first was diagnosed, the first thing that went through my mind at the time was, and I know this is kind of strange, but I felt like a relief that I was right. Because for some of you that may know my story, and I'll repeat it just real quick, I kind of had an idea that there was something wrong with me. And I started researching symptoms of gastric cancer and colon cancer. So I didn't feel as crazy when they finally told me that I had gastric cancer. So what I did is I went into, I guess, a crazy wanting to understand everything possibly about gastric cancer at the time, which led me to researching, trials that were available, studies that were available. So when I finally spoke to an oncologist, luckily I was able to understand what they were telling me. And at that time, what they were telling me didn't make sense to what was out there currently being offered to, gastric cancer patients that were just getting diagnosed in 2018. So that allowed me to go and get multiple, what's the word I'm looking for? I apologize. Opinions until I finally met an oncologist who was up to date with the standard of treatment. So that helped me out quite a bit in researching. And I would, my recommendation to anybody that's been diagnosed or currently in a situation where they're going through treatment is don't stop, looking for answers out there. You're your best advocate. We have a great staff now, a great team now that I work with, but I'm still sending my world-renowned surgeon studies that are out there that are taking place, just in case, God forbid something comes back, but just in case it does, we at least know what's possibly being out there for future therapy.
So it sounds like listen to your body and never stop searching while being your own advocate. Sounds kind of like the takeaways from yours.
100%. I think if I didn't listen to my own body, I wouldn't be here today, because if I would have just listened to the rest of my doctors that were trying to figure out what was wrong with me, I would have just accepted the fact that I had GERD, or accepted the fact that, I was lactose intolerant. And knowing my body, and who knows their body better than yourself, knowing the changes that I was going through, the loose stool, the excessive heartburn, those cues allowed me to go out and really try to find answers, and not take the first answer that the doctors gave me for what it was. I mean, the amount of time that I put into trying to figure out what was going on with myself, and then for them to give me a 2-minute answer and think that they have the answer, it didn't sit right with me. So definitely listening to your body.
I'm going to kind of throw this one out to everybody. And I don't know, I know some of your stories, but not everybody's. Is misdiagnosis in the beginning universal for everybody on the panel? I know it's common in stomach cancer. It's not. Okay.
It's not for me. No, I was actually diagnosed with, I would say, felt like really out of the blue. I did not have any symptoms or risk factors. I had just gone in just for an annual well visit when they discovered a mass on my ovaries, and that is what led to my diagnosis. I had Krukenberg tumors. So for me, it was completely out of the blue for me, and I didn't have any experience. I had done no previous research or had any information. So my first oncology visit, I felt like I had been run over by a truck with all this information. And my first question was, well, what are my treatment options? And similar to Jason, I felt like I was given a very, well, this is what we can do for you. And it was very limited. My options felt very limited. And so for me, what was really important was not just accepting that, but seeking multiple opinions. And we did that. We saw about 4 oncologists locally who all pretty much gave me the same options of care, but they all encouraged me to seek out a larger cancer center and pursue clinical trials. And so for me, that was my experience.
So you went in for an annual physical, and it turned
Yes.
into a stomach cancer diagnosis. And what was, did you know your stage right away?
Yes, I did. So because I had Krukenberg tumors, and that's what led to my diagnosis, I knew that I was stage 4 right off the bat, which was a lot to process. because a month beforehand, I had no symptoms. As far as I knew, I was perfectly healthy.
Wow. And what, upon finding, I mean, that's 1 month before you're perfectly healthy, and then all of a sudden, hey, stage 4 cancer. That's shocking. What happened next? And looking back, is there like, how would you handle it? How did you handle it? And how would you handle it, knowing now what you know? Maybe that's different. Maybe it's not.
I think that looking back at it, I can say that I'm really thankful for finding support very early on. Being able to connect online was where I found my support. Places like Hope for Stomach Cancer, where I found a lot of information. It was during COVID, so I didn't have a lot of resources that seemed readily available to me.
Right.
But yeah, it was a lot to process. Hearing suddenly, you're not healthy, you're actually dying. And we don't have a whole lot of treatment options for you. I think the shock of that, I just couldn't accept that. And that drove me and my husband to both push and do some research and seek out more options, which for me in the end was clinical trials. And I'm glad that we did that. I feel like that was the right path for us.
Okay. Okay. Camilla?
Well, I was diagnosed twice. So the first time around, very much like the other panelists talking about having symptoms and not, or being misdiagnosed, I had the very same experience. I remember just going to Costco and buying boxes and boxes of Prilosec because my doctor just said, you have constant reflux. Millions of Americans have it. You're young, you're healthy, you have no risk factors, you're fine. So it took me about 2 years to get an endoscopy. And luckily I was still early stage because initially I was 1B. I had surgery first and then I did 8 cycles of full box to just do mop-up chemo. That was all in 2018. So when I went through the experience the first time, I just didn't know anybody. I didn't know enough. I didn't even know you could get cancer of the stomach. I just had no clues. So whatever the doctor suggested, I agreed to. They said we should do surgery first. Sure. You should do chemo after. Okay. I didn't get a second opinion. I didn't ask any questions. And I was good. I was okay. I mean, I thought, you know, it's 1B. What's the likelihood that I'm going to have to deal with anything like this again? And I kick myself now because February of this year, I was diagnosed with a stage 4 recurrence to the peritoneum. But I did have a little bit of an advantage because 5 months prior to the recurrence showing up on CT scans, I had a positive Signatera test. So my oncologist and I, we were looking for it. We were looking for the recurrence the whole time. We just couldn't find it because it was at a microscopic level. But with the stage 4 diagnosis, I just went into overdrive. I just started spending all my time researching things from just like different chemo options to different regional therapies to things like CAR-T, NK. There's a lot of oncolytic virus interest coming out now too. So even though I'm currently NED, I am just constantly just putting things into my back pocket because I think you just need an arsenal of tools to work with. You just can't rely on one thing. So you can't just rely on the chemo. You can't just rely on surgical methods. I think you just really need all 3 techniques. So that's where I'm now. I have a 3rd HIPEC scheduled for the 23rd of this month. And that was a part of my original treatment plan. I didn't qualify for trials, so basically my surgeon designed a trial for me, and that included 3 HIPECs with FLOT. So we'll see how it turns out, but I'm very optimistic. I feel good. I'm able to function throughout my day, take care of my kids. So I'm very blessed.
Okay. You look very good, by the way.
Thank you.
We last saw each other
July.
yeah. We did a shoot here in Los Angeles that shared stomach cancer stories. And for those that are watching this for the first time on Hope for Stomach Cancer, there's lots more to stories, including Camilla's. So thank you again.
Thank you.
Okay, so Suzanne.
Yeah, so when I was first diagnosed, my doctor did the right thing. He immediately put me on Folfox, Opdivo, and Xgeva. And then I right away, but I didn't know if it was the right thing or not. You know, I'd never really known about stomach cancer.
I'm sorry, real quick. Your stage was again?
Oh, stage 4. Oh, I guess I skipped how they found it. My mother had cancer of the appendix and she died when I was 8. She was 33. So throughout my life, I've been getting colonoscopies.
Okay.
I just was already high risk. So I started having a lot of, my stomach bothered me a lot. And I would even throw up if I ate something doughy, like a chicken or bagel or something like that. And my doctor said it's reflux. And then COVID came and I didn't really worry about it. It was just every once in a while. But then things started to open up again and it started to get worse. So it was time for my colonoscopy. And I said, hey, maybe we should do an endoscopy because of my stomach problems. And sure enough, that's when they found the tumor. And then right away they could see that it was diffused. And then I had my scans and it was diffused throughout my bones. And my local doctor, like I said, he got me on the right treatment right away. And then I went to Hopkins for a second opinion. And the surgeon said, you will not live 2 years. We can't take your stomach out. We won't take your stomach out. It's already, even though we can't see it in scans, it's already through your organs. And, we had a long conversation and I said, well, I don't believe you. And
good for you.
I did believe you, then I would die really quickly. So I can't believe you. And we left it at that. We had a long conversation. But then at Hopkins, a couple weeks later, I got a phone call from a gastric oncologist and Dr. Bever. And so every time, my local doctor takes care of everything, but every time I have a scan, I see her too. So there's always just a little bit different what one radiologist sees versus the other, but it's never been different enough to change my treatments. So that's been good. And Hopkins agrees that I should stay in Frederick with my local oncologist instead of having to drive to Baltimore on a regular basis. But, they're there and I can't get into a trial because my metastasis is in my bones and it's not eligible. It's hard for the doctors to tell improvement in the bones. They can, but not as well as say like a liver tumor or the lungs where they would measure it. So I'm not on any trials. I'm just still on the first line treatment. And yeah, I have 2 doctors and I plan on always having 2, maybe out of 3 doctors. I think it's tough to just have one oncologist with this type of diagnosis.
And in your opinion, what should newly diagnosed patients do? What?
Yeah, I think you have to right away get a second opinion. It's it's too hard to diagnose. It's too hard to tell what's going on in the scans. I think it's important to have at least two sets of eyes on the situation.
And in your case, you mentioned you have two oncologists,
Mm-hmm.
and you're planning to continue that.
Mm-hmm. Oh yeah. Mm-hmm.
How does that work with insurance?
You know, that's a good question, and I'm always waiting for them to say, you can't do this anymore. But they haven't. I haven't gotten any pushback. I see my regular doctor, you know, all the time, every 2 or 3 weeks, and then every time I get a scan, or I'm just not quite sure I'm comfortable with everything that's going on, then I make an appointment with Hopkins. And that's it. I have yet to get a bill from them, so we'll see.
Okay.
Now, I will say, now Hopkins will do a lot more testing. It's than my local doctor will do. But so far, the testing hasn't shown anything that was actionable, like the circulating tumor DNA and these types of things. They're more interested in doing these types of tests than my local doctor is. So my family always worries, what's going to happen when Hopkins finds something? And I said, well, then if my doctor in Frederick doesn't want to act on it, and I think he will, we have a good relationship. We have, he knows I respect him, but he knows I look everywhere. I'll have to make that decision and start driving to Baltimore if he doesn't agree, but I don't see that happening.
I love how proactive all you guys are. And thank you again for sharing this. Okay.
Can I just add something really quickly
Absolutely.
to what Suzanne was saying? I often get messages about who is the best oncologist to go to for this type of cancer, or who's the number one. And I always tell people that's so relative, because you really, really want an oncologist that's going to work well with your personality type. And trust me, I challenge my oncologist. He probably rolls his eyes every time I walk in. And I pull out my phone and I'm like, I have a couple questions for you. But that's the kind of relationship I think you need. And it may not be from the best institution, or this person might not have the best title or recognition or awards. But I think it's important to find that team member who's going to be your collaborator, and who is also open-minded enough where if you do challenge them, or you bring in studies, or you bring in data, that they'll accept it with an open mind and at least review it.
Sure. Yeah,
So,
I'd imagine a doctor could be, patients coming to me for care, but then also bringing me suggestions or questioning me. Well, I'd imagine there could be a little ego there. So, all the more important to have somebody you're not only comfortable with, but maybe more than one person that you need to be comfortable with. And guys, by all means, if there's ever anything to add, feel free.
I agree with Camilla, what she said, and with Jason. It's important to be really proactive. It's important to be your own advocate, to do the research, to come to your doctor with those questions, with those studies that you found. And I wonder if we could try this. And it's important that whoever your health team is, whoever your doctor is, that they're on your side, and that their interest is your care. And so putting any ego aside or any of that their interest is to get you the best care. That's really important in your doctor. The only other thing I would say in terms of, like, you've just been diagnosed, what do you need to do? You need to get a lot of testing done. I think one of the best pieces of advice I got early on was know your cancer. Learn about your cancer, do the testing, find out, do you have genetic mutations? What are your biomarkers? You need, like Camilla was saying, you need to know everything that you can, that puts tools in your arsenal, because this disease requires everything. And so to know specifically your cancer, your disease, what may be available to you later on, you can learn a lot early on by doing testing soon.
Okay, thank you. Mrs. Chavez?
Hi. So I think my story is very much like Rachel. You know, were there a lot of telling signs, probably, that I was completely unaware of? You know, like everybody, well, or mostly everybody, I was suffering in 2015 from a lot of reflux, a lot of indigestion, very low energy. I was living off of Prilosec, and you know, after a really bad night, my wife, you know, was like, enough. You cannot be living off of this stuff. You know, let's get you in to see a doctor. I fought her every inch of the way. And we were lucky enough to get in to see a gastroenterologist, and talking to him, I was like, I don't know, maybe it's my gallbladder, maybe it's, you know, gastritis, everything on the planet. I was very fortunate that he was not okay with it. He was very adamant that I lived a very healthy lifestyle. I was active. You know, and his concern for me was that I shouldn't be in this much pain, you know, being 34 years old. And all he wanted to do for me was to give me a better quality of life, whatever that meant. And so it came from him. He said, let's do an endoscopy. Let's just figure out what's going on. I don't think I'm going to find anything. That's verbatim what he said to me. He's like, but I really want to help you. You shouldn't be suffering this much. And literally 7 days later, you know, we got the call and to come into the office. My hemoglobin count was really low and I needed to be admitted to the hospital for blood transfusion. And when we got into his office and he sat us down, he had said, you know, that my pathology report had come back from my biopsies, and it was gastric cancer. And I think, you know, nobody could really prepare you for that. I didn't even understand what that meant, honestly. Like some of you said, I didn't even know that was a possibility. I was fortunate enough that he, you know, he had trained with a surgeon at a local hospital, and he had already called him and set up an appointment for a consultation. And, you know, and the gastroenterologist, I mean, all he wanted to do was to prepare me, you know, for this battle I was going to go down, right? That I didn't even understand. I mean, I remember him coming to the hospital room later that night and, you know, saying like, how are you doing? Are you okay? Have you called your family? And I just said, no, I'm okay. You know, I feel okay. And he's just, you know, and I said, I don't want to tell anybody anything until we have more answers. And I didn't want to scare anybody. And, you know, he looked at me and he said, Irasema, it's cancer. You know, he's like, we already know it's cancer. So he's like, I just, you know, I think you need to mentally prepare yourself, you know, for this as well, and prepare your family. And I think, you know, it's overwhelming, right? I mean, we went to the surgeon and we've seen the surgeon, and the surgeon is talking about removing my stomach. Maybe he could salvage a little bit. And then I felt like I'd been hit by a truck again, because you're just kind of, I mean, you know, I didn't know that somebody could live without a stomach. I thought, am I gonna live off of like a feeding tube the rest of my life? We sought a second opinion at a cancer institution, and just to see if that was, you know, their recommendation as well. And they said we would do the exact same thing. And at that point, I felt like I had a better rapport with the first surgeon. So we went with them, and it wasn't a huge institution. Yeah, but again, I felt like I connected with that doctor, and it was really important. After my partial gastrectomy, I had 3/4 of my stomach removed. When my pathology came back, we realized that there was lymph node involvement. So I was stage 2 at that point, 2B. And
so that's when you were staged at
yes,
that point?
Yeah,
so
at that
the first
point
was 2B. And then was when you were stage 2B, was that the stage that did that change before through any second opinions or anything?
No, it did not change.
Okay.
I think once there's a lymph node involvement, I think that's how they kind of stage you. My surgeon then at the time said, I have an oncologist who's a young guy, but he's brilliant. And I think that, he's going to come and see you. I was still in the hospital. He's going to come and see you. And, and I think you should meet up with him. If I had anybody he's the doctor I'd send my family or my kids to. And I said, okay. I mean, in walks in Dr. Klempner, and everybody, I think, in the stomach cancer community now knows who Dr. Klempner is. But at the time, I think he was just starting out, and I was blessed to have him, to have him be my doctor. I did mop-up chemo, and I did 4 rounds. I did 3 rounds actually first. I did 25 rounds of radiation, and then we did 1 more round of chemo after that. I was NED for about 8 months. And then during an endoscopy, it'd been a year since my partial gastrectomy. We were just making sure that everything had healed properly, everything looked good. And even the gastroenterologist who did the endoscopy at the time was like, everything looks beautiful. He's like, whoever the surgeon was that did your surgery did an amazing job. I can't believe how beautiful it looks. And we were great. I had clear CT scans. We were so happy. And a few days later, we get the call to come in and see Dr. Klempner again. And I think we all knew, obviously at the time, we knew what that meant, that my cancer was back. I was fortunate that it was found early again, in the local remaining part of my stomach, and it was microscopic as well. So we went in for a total gastrectomy, and I've been NED for 6 years now, 6 years this November. So, yes.
Newly diagnosed patients, what would you recommend their first steps be?
I think it's important I'll tell you, when I was diagnosed in 2015, I didn't find a community. I was very fortunate that I had a lot of family and everybody rallied behind me, my friends. But I didn't find a stomach cancer community, right? So it was hard to get somebody, to get somebody's perspective on when you were feeling, not well. I mean, you'd be like, oh God, I'm doubled over in pain. Is this normal? Should I be freaking out? I think if I can share anything, it's to find somebody who is going through it or have gone through it, so that you have somebody to connect with who really understands what you're feeling. Because I think we shield so much the personal battles, right? From our families, because we don't want them to know how debilitating mentally this can be. But I think it's important to find yourself a little family, a little stomach cancer family to help you, get through it.
Very good advice. Thank you, Irasema. Okay, so I got a note from Aki asking to go through some of the Q&A that has been submitted. So the very first one that I see here, and we'll do some of these, and then we'll get back kind of on the agenda. But like I said before, we'll kind of keep this informal. But the very first one is actually directed towards Rachel, and wanted clarification. What clinical trial are you on?
So I am on a phase 1 clinical trial. It's through MD Anderson. It is actually not gastric specific. That's one of the things that I ran into going through the process of qualifying for trials. There is a qualifying process. And so multiple trials that I was on, I did not meet the requirements. And that's just something that you have to be aware of when you're pursuing that. The drug that I am on is sacituzumab govitecan. Again, it's not gastric specific. The drug.
Sorry, real quick. That is a mouthful.
Yes.
Can you just spell that for?
Let me look it up.
Oh no. If you don't know it off the top of your head, that's okay.
I have it in my notes because people ask me that a lot. It's just a question if I can find my note for that.
Just.
Yeah, sure. It's SACITUZUMABGOVITECAN. Sacituzumab govitecan.
Okay. If I can be light there, I'd like to say God bless you. So I interrupted. I apologize. Please continue.
Yeah, that's what it is. It's a phase 1 trial. It's not gastric specific. They had seen in a different trial that this drug may have positive effects for gastric cancer patients. It's actually a FDA approved drug for breast cancer. So that was encouraging to me, and it has been working well for me so far. I have had a little bit of reduction in my scans. Most of my disease is peritoneal, and that's a hard area to treat. But we've seen a little bit of reduction and otherwise stable scans.
Okay, thank you. Here's a question for the whole panel. Has anyone had to switch lines of therapy due to progression? No? Okay. And then we have one specifically for Irasema. When you had your reoccurrence, what was your stage? I think we might have covered that since, but go ahead.
So I honestly, that's a very hard question. I think because it was still, like I said, very microscopic and within the remaining portion of my stomach, I don't know that I was really staged again. I mean, basically, I was told if I can just remove the rest of my stomach at that point, I would be cancer free. I did not have to do additional treatment. I don't know, knowing what I know now, again, my reoccurrence was in 2016. Knowing what I know now, I don't know that I might have fought for, a little more treatment after that surgery, because it's scary. But I I was never, and maybe I just didn't really ask either, right? I trusted my doctor and I wholeheartedly. So I just did what he told me to do, and I'm here, fortunately.
Thankfully.
So.
Okay, thank you. So we're going to continue with the agenda questions, and the next one, and I think we touched on, we're probably going to come across this. We've touched on a number of things already, but we'll go a little bit more, go over it again to make sure that we have everything covered that we need to cover. How did you find your care team, and what did the process look like? And why don't we start with Jason?
So after getting multiple opinions, I decided to go to an actual, cancer center, which was City of Hope. And like I mentioned earlier, they were on the same page with the current treatment that was being, the standard of care treatment that was being offered at the time, whereas the community hospitals that I went to, and I went to 2 of them, were not. But the one thing that really made me gain trust in my City of Hope team was I was adamant at the other locations about being genetic tested, because I had had an aunt that had passed away 9 years prior with gastric cancer. So when it was determined that I had gastric cancer, I was trying to tell everybody and anybody that would listen to me again that I should be genetic tested. But at those local hospitals, community hospitals, I didn't fit the criteria of what they thought I needed to be genetically tested. So when I went to City of Hope, just based off of my age alone, being that I was diagnosed at 32 years old, they went ahead and they genetic tested me instantly as part of my treatment plan. So when they genetic tested me, or when they came to me with that treatment plan, as well as, my chemotherapy that was going to be up to date, I was really able to gain a lot of trust with them right there, or they were able to gain a lot of trust with me, I should say. And then unfortunately, fortunately, however you want to look at it, I did come back with the genetic mutation of the CDH1 gene. So now, yeah, that's where we're at now.
And, I think this is something to identify. Jason, I know I've known you for a number of years now. You're in Southern California. So I think in being in a larger metropolitan area or region can have its advantages. So that played a factor for you, correct?
Oh, absolutely. So unfortunately, Los Angeles, when it comes to stomach cancer, is we have the highest rate of diagnosis here throughout the whole country. But at the same time, we also have some of the best facilities available to us if you're able to get in, right? That's a huge opportunity in itself for many of us out there. Fortunately enough, I had insurance that was accepted at the time at City of Hope. So it wasn't really hard to get into. It was just more of being pushy, making sure that I called them up, letting them know that I was waiting for a reply. I do recommend, and I didn't mention this earlier, but now that it just came to my mind, I do recommend, even if you are at a community hospital that you are not for sure if you're going to go with, if you're able to get the testing done there, 95% of those tests will transfer over if it's within that time frame of going to another institution. So it saved me quite a bit of time and was able to accelerate me going into treatment right away was I already had multiple scans at the community hospitals while I was waiting to get into City of Hope. I had already had multiple endoscopies before I went to City of Hope. So they were able to use those tests and use those results. And I was able to bypass that as I went to City of Hope and just jump right away into my treatment plan. So I do have to say that, you know, if you do have the ability to get those testings done, I would jump on them wherever you can right away as you're trying to get into that cancer center of your choice, of your liking.
And I'm just getting a note from Aki, who's managing this whole thing from the sidelines. I guess she's kind of like the general manager up in the skybox. Any other tips for or things that newly diagnosed patients should know in regard to genetic testing?
So the way that genetics testing works, there's actually a guideline to get genetics tested, whether it's for gastric cancer, breast cancer, appendix cancer. The way that it works is somebody in the same branch of the family. So if it's from your dad's side, it has to be your whole dad's side. It can't be your dad and your mom's side. Has to be diagnosed or have a history of the same exact type of cancer. So if you were to go in and say, you know, my mom had breast cancer and my dad's mom had breast cancer, they're going to say, no, that doesn't qualify for genetics testing. However, if your mom had breast cancer and her sister has breast cancer, then you should automatically be able to qualify from an insurance standpoint for genetics testing. Now it's up to the institution at that point to go ahead and request that genetics testing. But from an insurance standpoint, you should be able to qualify for it. So like I mentioned, being that my aunt had passed away 9 years prior from gastric cancer, I had to jump through hoops at first because no one wanted to genetics test me at the community hospitals. And I went ahead and I was able to get her death certificate and request through her husband, her medical history, just to determine that we had the same gastric, signet ring cell diffused type of cancer. But usually you shouldn't have to jump through that many hoops. But that's the way that you get genetics testing. It has to be two family members under the same tree that have the same identical type of cancer. Now, I'm sure there's maybe other ways around it, but as far as the way that it's written, that's from the clinical research. That's the way that you get genetically tested. And now
I'm sorry, go ahead.
No, I was going to say, and then going forward, once I was diagnosed with the genetic mutation, now I have probably 20 forms that I'm able to hand to family members who are in the same line of family that I was diagnosed in, which is actually my grandma's side. So anybody that has blood related to my grandma can go with this paper to their doctor, and now they could request a genetics test. And this paper pretty much signs off on the doctor having to request it without having to jump through any hoops.
Gotcha. And that ties right into what I was going to ask. With regard to either it be at the physician level, the hospital level, or the insurance level, in order to get the testing, I know you said there's certain criteria, but did you have to prove anything like with documentation, or can you just answer the right questions the right way and help move your case along?
Right.
I mean, you could answer the questions the right way, but you're going to have your doctor sign off on you because they could put the request in, right? And this is off the record, but obviously we don't have a lot of history from our great grandma or, our great cousins or second cousins because,
nobody knew about stomach cancer.
Yeah,
right?
We didn't keep track of anything like that back in the day. So there are ways around it, right? I mean, there are ways to say, hey, my great grandma passed away of stomach cancer. We know this for sure. Now I have stomach cancer. If you're a physician or you're oncologist, sign off on it, they can request it with the petition to get you tested based off of a family history that's unable to be determined, but they believe there's truth behind it. I do, like I mentioned, I did have to go and get my aunt's death certificate that showed it was gastric cancer related.
Okay.
And then I did get her medical records from her husband as well too. But that was when I was really trying to jump through hoops to try to prove that we both had gastric cancer. Whereas City of Hope, they already had it in mind already, so it was a lot easier with them.
Gotcha. Okay, thank you. The boss is now requesting we go to Suzanne. And again, the question is, and we'll tie in the genetics thing, how did you find your care team and what did the process look like? And then tying in the genetic aspect.
Well, I already talked about, I was happy with my doctor, and I do have my second doctor. And one thing that I wanted to add to that part is that I do see my general physician, my family doctor, every 3 months. I have a standing appointment with her. And I think it's really important. And I'm so glad when that appointment comes, because every 3 months I have more questions. And, your oncologist can only answer so many questions. I have her check my vitamin D level. I have her check my, I had a couple levels of just different vitamins and minerals that were just not quite right.
Sure.
Hard to think what else. To check and see if I had rheumatoid arthritis, to check all of the different things that you can get from the thyroid and the different things. Sorry, I'm losing my train of thought, but there's just so many things. And I feel strongly that if there's any other little thing going on, I want it addressed, because it's so hard for your body to fight gastric cancer and then to have a little something else not quite right, especially like vitamin D or something like that, that can so easily be resolved. To have a good doctor on this, on the side that you're seeing every 3 months,
right,
keeping track of all those other little things and just fine tuning and making sure that every other part of your body is running as healthfully as possible so that you have the energy to address your cancer. And then as far as genetics go, I do have a family history of cancer, plenty on my mother's side and also on my dad's, but I had already been getting genetic testing since the time my girls were little, because my mother was very young and my aunt were both young when they died. But there was nothing was ever found until my stomach cancer diagnosis. The geneticist found CTNNA1, and it is related to gastric cancer. But at the time, a year ago, they said it was of unknown significance. And to be honest with you, I kind of forgot about it. I mean, I've always figured my cancer was genetic, but I didn't know, how that played into treatment or what to do about it. I just, I always tell my children, you get mammograms early, you get colonoscopies early, we go to the dermatologist to have our moles checked, just.
In your case, I'm sorry to interrupt. In your case, what is early? Because it sounded like it was really early when you mentioned it before. So
my mother, my mother I was 8, my mother was 33. But then when I started genetic testing?
Yes. And I think you mentioned scopes pretty early as well.
Mm-hmm. As soon as I started having children. So like 29.
Okay.
Yeah. I started young, it was just kind of this, once I got pregnant with my first child, it was like, oh my gosh, I don't want what happened to me, losing my mother, to happen to my children. So I was always, worried about this, but I just didn't know it could be gastric cancer. So as far as the genetic testing goes, I've recently learned that CTNNA1 or Dr. Davis says we're starting to see that it is similar to CDH1. So my girls are going to get genetic testing. My brother and sister are going to get genetic testing over the holiday break. And one thing that I don't know if everybody knows, you can do this, heaven forbid I were to pass I have the special form that my geneticist did, and I wish I knew the name of it, but my blood will always be there and it will be constantly tested. It's in a trial, just my blood. So that if something else were to be discovered in my blood that is related to the other cancers in my family, my daughter will be notified. So they'll always be testing my blood and comparing it to things that have happened in my family. And so a geneticist can put just your blood into a trial like that, so that your family will will continue to have more information.
Huh. Didn't know that was a thing.
Yeah.
And then one other question that I have, and I think you touched on this, but so you have your primary connected you with an oncologist, but then you also have the second oncologist. Talk a little bit about adding that second oncologist and kind of the dynamic with your overall care team, as it might relate to anybody else that's newly diagnosed.
Well, so far it hasn't really impacted anything because I'm stable. But my doctor knows every time I see him, I say, I went to Hopkins, or I had a video chat with Hopkins, and, we're all still on the same page. He knows I talk to them. He knows he has her information, and it would just be a matter of if they ever disagreed. And so far they have not disagreed. And he'll say to me every once in a while, anything new from Hopkins? And I'll say, nope, nothing, nothing new there. So, I think it's been over a year, and like Camilla was saying, it's having a good relationship. And to be honest with you, if he had a problem with me seeing other doctors, then he's not the right doctor for me.
Sure. Okay. Thank you. Camilla, you're up next, if you would, please. How did you find your care team? What's the process look like? And then sprinkle in the genetic aspect, if you would, please.
Sure. So once I was diagnosed with my stage 4 recurrence, I kind of jumped quickly on to, I was texting everybody I knew, hey, who are the aggressive surgeons? Who are the ones that look at, other treatments, look outside of standard of care? Reached out to Aki, talked to Jason, and through which I was able to meet Dr. Rowe, who is my HIPEC surgeon. And, because when you do HIPEC, there's the surgical portion, but there's also the oncology portion where the oncologist has to order the HIPEC medications. I needed that approval, which I didn't get in the beginning. And because I thought I could try to bypass that some way, I don't know why, I started to reach out to other oncologists, other HIPEC surgeons. And in that way, I was able to meet some of my team members, one of which, unofficially, is Dr. Klempner. And I've been just picking his brain because everybody tells me he's the guru of ctDNA. So I just started emailing him, and he just kind of became an unofficial consultant on my team. Obviously, Dr. Rowe from City of Hope. My original oncologist from 5 years ago is through UCLA, and I love him to death. I just have the kind of relationship with him where I can text him on a Sunday and tell him about my diarrhea episode, and he's on it. So I think that's very important. And who else? Oh, so Dr. Chow from City of Hope, who recently left, and now I have a different oncologist named Dr. Lim there. I do not see my primary doctor anymore. I used to get just yearly annuals with her, but I think what she could do for me at this point is just beyond her scope of expertise. So my UCLA onc is a hematologist as well. He manages all my blood work, my nutritional labs, my chemo, immunotherapy, Signatera testing. And so I do have an eclectic mix of people from different institutions. I won't say that they communicate a lot. I usually have to facilitate the communication. I have to start a group email. I have to nudge people to chime in. I have to remind people to respond. So there is that footwork that goes into it. But I really believe I assembled a team. My husband was like, "You're assembling a dream team." And I'm like, maybe not a dream team, but as close as you can get to a dream team. And I'm not saying that that's even going to matter in the end, but I just wanted to try. I just wanted to go full stop. I just wanted to try it and say that I did my best to get the very best people for me on my team. And I thought it would give me the best chance of survival. So just talking a little bit about the genetic portion of it, I was tested for genetic testing because I was diagnosed with poorly differentiated gastric adenocarcinoma with signet cell under the age of 40. So that was the only thing I needed, and they tested me. Surprisingly, I actually came back with a mutation on the CDH1 gene. So essentially all cancer is driven by mutations, whether it be germline, that's inherited, or somatic, acquired. So I had a germline inherited CDH1 mutation, but they had designated it as a VUS, a variance of unknown significance, because they weren't sure what damage, if any, it would do. So currently, when you have a gene mutation, you will have pathogenic, likely pathogenic. There's that VUS that you just don't know about. Likely benign, benign. So I'm just caught right in the middle, big gray area. Most VUSs are. There's just not going to be enough information until more people with our specific VUS, I guess, comes out of the dark and says something. And I don't think that typically happens unless there's a diagnosis of cancer. So I will get my kids tested when they're older. Currently, they're only 8 and 10, but in their late teens, I'll go about and do that. And as far as I know, my family, neither my mom's or dad's side, there is no history of gastric cancer.
So I think with the care team and with the boss chiming in on direct chat to me, I've gotten a little bit off track as far as keeping track of who's answered everything. Irasema, did we cover you and care team yet? I think we have that.
I think yes, on care team. In terms of genetics, I will say that at the time, again, because I was diagnosed at 34, it was 2015. I had, my mother had passed away when I was 10. My biological mother had passed away when I was 10, not cancer related. And my father was never in the picture. So we really didn't have a lot of history to go off of. So for Dr. Klempner, it was really important to make sure that there weren't any genetic history factors that we needed to make sure we were aware of. My genetic testing came back negative. And when in 2020, when I was diagnosed with breast cancer, we did genetic testing again to see if there were anything that had been discovered from 2015 to 2020. And again, I just turned 40 when I was diagnosed with breast cancer. So I think we were all expecting there to be something to tie in those two diagnoses, but I've got nothing. I'm just lucky. So.
Okay. Unless I got to everybody on team care now, right? Little nod, or how you got your team together, right? Okay. So now we're going to talk specifically about how long did it take for, or how long did you have to wait from diagnosis to treatment, and what was the start? Which why don't we start with Rachel?
Sure. So my situation, this is where COVID had a big impact on getting care for me. We had gotten diagnosed, pursued a clinical trial, did not qualify for it. We knew we needed to move forward with first-line treatment, chemotherapy. I needed to do just some diagnostic procedures. I wanted to have a laparoscopy done just to get a clear baseline to start that. That's when my husband came down with COVID. He quarantines. I quarantined from him. But it was 12 days after his positive that I became symptomatic as well. So during this time period, this was early 2021. So it was very much all around us. Everyone was being very careful. Quarantine restrictions were very long. I had to push my treatment, all told, a month to get those diagnostic procedures done. That was really terrifying because I had just received this terminal diagnosis out of nowhere. So that was really frustrating. So it took me longer from being diagnosed to starting treatment. I was officially diagnosed in December and I started treatment, chemotherapy in March.
Okay. And I mean, geez, dealing with COVID during that time is, wow. Other than suggesting that you don't get diagnosed during COVID, do you have any insider pointers that you might offer newly diagnosed patients?
In terms of that time in between being diagnosed and when your treatment actually begins, I think seeking out multiple opinions is really valuable. I think we've all the panelists have talked about getting multiple opinions during that time period. I'm very in favor of clinical trials, and there is this time period that you have not received any treatment lines, and that's a one-time thing. And so there are some trials that you may want to look into that only accept people who have not had previous lines of treatment. Other than that, I think it's a really important time to be building your support system, know who your people are, who can help you meeting logistical needs, get testing if you can, find support groups online, people that you can get information from. I think that was really valuable to me.
Build that support family. Okay, Jason.
Yeah,
so go ahead. You
no, yeah. So like I mentioned earlier, that I was very fortunate enough that I was getting all of my testing done at the community hospitals as I was trying to get into City of Hope. And I was actually having testing done at 2 different community hospitals. So I was going in for a CT scan on a Monday, having an EUS endoscopy on a Tuesday, going back to another community hospital and getting blood work on a Wednesday, having a PET scan done on a Friday. So, I mean, at this point, I had already called out and said I wasn't going to go to work. I had let my job know that I had been diagnosed with cancer. And fortunately enough, they went ahead and told me, take as much time as you need and just keep us updated on what's going on. So I was fortunate enough, I know not everybody is, but I was fortunate enough to be able to get all these testings done within a week. So when the 2-week wait of me getting into City of Hope finally came through, the only thing that they really wanted to do was do a laparoscopy on me. And at the same time, if, they were going to put my port in my chest as well too. So I was able within the first 48 hours of going and visiting City of Hope to have my laparoscopy and my port put in. I started chemotherapy 2 weeks later. 2 days later. So the whole entire process from being diagnosed at the end of June to starting treatment was about 2.5 weeks And that was on the clinical trial as well too. I guess my biggest piece of advice, like I mentioned earlier, is a lot of these tests and a lot of these procedures they're able to be worked off of each other. And you know, a gastroenterologist is going to be able to do an endoscopy the same way, more than likely, one will be able to do at another center. At least you hope that, right? In my case, that was the case. So those tests were able, and those scans and everything were able to be seamlessly delivered via email to City of Hope. So that jump started the treatment right away. I would say this though, because I am very candid about talking about researching online. It's not for everybody. It's definitely not for the faint of heart. Because when you do research stuff online, you know, it's like a review for a restaurant. 9 out of 10 times it's going to be negative. You might have that one good one, but usually people are going to go on there and talk about, you know, what they didn't enjoy. It's fairly similar with cancer. You're going to see a lot of stories of people, you know, not getting the treatment that they should have gotten, or, you know, not making it past a year. And it could be disheartening, and it could really throw you into a whirlwind of emotions. So if you are newly diagnosed and you do choose to go that route, which is the route that I chose, just be prepared for what you're going to read, but just also know that, you know, you're not a statistic. You are who you are, and you are more than capable of going out there and proving those statistics wrong. Just remember, not everybody's on the internet talking about their stories of surviving and doing well. And I'm a huge advocate for, you know, people sharing the stories, because I know there's a lot more out there than just the panelists that are on this Zoom call right now. But yeah, just be prepared for that. And then, you know, also be prepared to take a lot of notes. But if you aren't a good note taker, record the conversations. I know that in the very beginning, before Rachel's clinical trial drug that she's on, I've never heard of it before in my life. And that was the case when I was talking to certain, you know, doctors. They were saying things that I had never heard, even the things that I have read on the internet, I had not come across that. So being that I was able to record the conversation and really go back and analyze what they said, because a lot of the times when you're going through your treatment or you're going through your diagnosis, and every time you hear the word cancer, you can kind of, you know, space out a little bit. You know, just find a way to try to retain that information so you could always go back and, you know, review it, question it. If something didn't feel right, but you left the doctor's office, you could always go back and listen to it, and then write your note down or write your question down and then email them, or whatever the case may be. You know, just always try to have a way to try to retain that information as possible.
Good advice. Yeah. The recording, and then also as a lot of you guys have pointed out, excuse me, the importance of having a team that you're comfortable with, so that when something does come up, you can feel comfortable reaching back out to them with whatever that may be, even if it's outside of a scheduled appointment. Okay, so diagnosis to treatment. Who wants to go next? Camilla?
I'll talk about both experiences. So the first time I was diagnosed, I got the official confirmation that I had stomach cancer. It was June 1st, 2018. And on July 2nd, I was going in for my gastrectomy. And that was actually delayed. I was supposed to go in June 28th, but my insurance hadn't cleared, so it ended up being July 2nd. And it took all about 4 weeks to get all the tests, all the imagings, EUS staging or preliminary clinical staging done. And I was deemed stage 1A. That's why I went into surgery first. But it took about 4 weeks to do that. And then the chemotherapy I started 6 weeks after my gastrectomy. So it all moved very fast. My stage 4 recurrence, it was like a buildup because I got that positive Signatera test, and then I had those masses on the CT in December. But when I got the final biopsy results back, that said it was cancer, and it was on my ovaries, were Kuchenberg's. I got that on the 9th of February, and on February 12th, literally 3 days later, I was in surgery getting them removed. And then a month after that, I started chemo. So it's really gone fast for me. I've actually had no waiting time. I've actually asked my oncologist, can we take another week before we start the treatment? So I know not everybody has that experience, but I was very lucky to have gotten in so quickly.
And also in Southern California. So as far as resources to multiple highly qualified facilities.
Absolutely. So my UCLA oncologist is also actually on staff at Cedars-Sinai. And his wife is also the nurse practitioner for the gastric oncologist there. So so they were able to present my case to their tumor board as well. So I was able to generate opinions from City of Hope, UCLA, UCI, Cedars-Sinai. So and I was willing to go as far as San Diego as well, but I just didn't have to because I had really good options here.
Sure. Great, thank you. Diagnosis to treatment. Next. Irasema, are you raising your hand?
Yeah, I'll go.
Okay.
Goodness, I was diagnosed on May 15th of 2015. And I had surgery on June 8th, 9th, maybe. I'm trying to think. I mix up the dates, but I think it was the 9th. So a month later. And then I started treatment 8 weeks after that. And it was just to allow my body to heal. Right. I know we had you kind of have that after surgery, you have 8 to 10 week window to when you really want to start treatment. So really leading up from that diagnosis point, it was really, I feel like the fastest 4 weeks. We were trying to get my body strong enough really to sustain surgery and get a second opinion. It goes by really fast trying, again, the endoscopy was already done, but the PET scans, it's overwhelming. And I think with my reoccurrence, I probably had my reoccurrence. I had my endoscopy in very end of August. So like August 31st, we probably knew a week later in September. And I would have had surgery probably in October, but my daughter was having a big celebration, a 15th birthday, and I was not willing to not be able to attend that. It was, it's culturally a huge thing. So I waited to have surgery until November. Like I said, it goes by really quickly. And I think it can be very overwhelming. It is a great time for you to kind of wrap your brain around it. I'm a little opposite of Jason. I think Jason threw himself into trying to be as knowledgeable as possible. And for me, I think my oncologist, I asked for some advice, right? And for him, he said, if I can give you any piece of advice, it's don't research your disease right now, right? He said, you are 34 years old. You don't fit the mold. You don't fit any of those statistics. It can be very overwhelming. And he said, and I just don't want you to put your mind in that headspace. Luckily, I my caregiver, my wife, kind of did all of that on her own, and she took that, she took that into her hands. It's not for everybody, right? I mean, there's so many people, obviously, who are so educated and so knowledgeable. But for me at the time, that was probably the best decision I could have done for myself. So.
Thank you. Did everybody answer diagnosis to treatment? Yes. Let me cover this one while we're at it. It sounds like it was up from diagnosis to treatment. It was a preference thing, and what you were comfortable with. It sounds like Jason was very, I don't know, aggressive in your knowledge acquisition, and maybe on the opposite side, Irasema was taking a more a more slow approach. But was anybody held up by insurance? Was that a diagnosis to treatment? Did insurance, was that an issue for anybody? Did that cause a speed bump, an obstacle?
So, Tom, I had one issue with insurance for the clinical trial originally. They weren't going to cover a portion of it, but City of Hope, they assured me that it was just protocol and that they would get it approved. So I think that I guess your team, going back to your team, just putting your trust into them, because I was getting billed crazy amounts from my insurance even after they originally didn't sign off on it. But the clinical trial team, or the clinical trial research nurse, was able to route those to the clinical trial. But that was really the only hiccup that I had with my insurance, was based off of that clinical trial.
Anybody else?
I did. I just had it was a delay of a couple days, but I was supposed to have my gastrectomy on June 28th. So he told me, stop eating, drink that stuff that clears out your system. Did all that. And then that evening I found out, well, we couldn't get your insurance to approve. So we're aiming for July 2nd. So I had to do that whole procedure. What is it called? Go lightly, or something that makes you just dump out your innards.
Right.
So
right. Before colonoscopies, right?
Yeah. I mean, so I had to do that twice, but other than that, I haven't had any issues.
Instead of go lightly, they should call it don't stop going. So we covered this, but we got another question on it. And so I just want to clarify it. And I think this is specifically for Suzanne. Did you have any insurance issues specifically with your two doctors? And I know that was one of my curiosities in the very beginning, but that question has since come up. So would you mind addressing that again? Maybe adding anything that you might have forgot when we covered it before?
No, I haven't had any issues. Now, that being said, my second doctor hasn't ordered any treatments for me, but my visits to her have all been covered.
Okay.
I think maybe she's billing it still as a second opinion. But also I plan on probably soon going to University of Maryland to get a third opinion. No, I haven't had any problems. Again, she's not making treatment decisions for me, but she has ordered tests, and I get my scans read by 2 radiologists. Every time there's a scan, I get the disc. So my local doctor reads it, local radiologist. Then my boyfriend sends it to Johns Hopkins, and a couple days later in my portal, I have a second person reading it, and I've been doing it for over a year. I'm in Maryland, and so far I haven't had any pushback.
And that actually brings up another question. in my mind that actually Jason and I had when you were talking about the two different community hospitals that you were going to. And this really is for everybody. When you're going to multiple hospitals or doctors, and insurance aside, getting them all to communicate, sharing the test results and scan data, etc. Has that ever been an issue? Do you have any suggestions for newly diagnosed patients in that regard? And this is to anybody.
I think what helped me was I was very, very adamant when they would say that they needed to call and get a referral, or they needed to call and get an approval. I was very, very adamant that they did it right then and there, even if that meant me being there while they called. Because at the community hospitals, I was able to go to the centers and deal with the people directly face to face, versus like maybe a City of Hope, I would have to deal with their billing department, and they might not be located, in Duarte. But my community hospitals, they were located directly in the hospitals that I was at. So just being very, very persistent and having them call and get it approved, it really probably added an extra hour of my time. There was one time in particular where I went in for a CT scan, and I had just had a PET scan, and they wanted to do a CT scan now of not just my pelvis and my stomach, but they wanted to do my chest as well too. And that one took a little bit more just because I had just had a CT scan done a couple of days prior. But given the circumstance that it was cancer, and and when I was first diagnosed originally, and I didn't touch base on this, but we knew it was more. We knew that it was at least locally advanced. We knew I wasn't stage 1. We knew that I was going to need treatment initially. It just wasn't sure where my stage was going to lie. So originally they diagnosed me at stage 3. And when I got diagnosed, I think when we were dealing with insurance, luckily they kind of understood the urgency behind that. So there wasn't much needed to get approved if it made sense what was in line with the treatment for that, or the diagnosis for that.
Got it. Thank you. Anybody else want to chime in on that one?
I think something that's been really helpful for me is always get your CD of your CT scan wherever you're getting that done. You need to be responsible for having
before you leave.
I get it before I leave. You need to be responsible for having that imaging available, because there can be different times when I sent over the report, but it's just the written documentation. They don't want to see that. They want to see the actual pictures of the scans. So things like that. Different times I try to make a point of being like, are you putting that in the notes? Like if I'm talking to a doctor, and then I can go back, and utilizing my chart is, I think, very helpful. I can access those notes and share them with my other doctor that I'm maybe seeing. So you're not relying on portals to talk to each other and people to upload stuff. You're being as proactive as possible and gathering everything you can on site while you're there. I try to be responsible I like to have my own documentation, just in case there's any issue, any breakdown in doctors communicating with each other.
Anybody else want to chime in, or we got that one? Okay. Aki wants to talk about I guess somebody covered that one. It disappeared. Precision medicine. What is precision medicine? Easy for me to say. What is precision medicine? Did you have any blood tests or saliva tests? What company did you choose? Did you get a bill? Did insurance take care of it? Did you have to ask? Was it automatic? Would anyone like to share their experience there?
Are you talking about like NGS? like tumor biomarker profiling, like
I believe
Tempest
so.
and
Yes.
Foundation One.
Yes.
I can share about, I've had the Tempest done twice now. I don't know why twice, but that's how my oncologist ran it. It came back with the same results. Initially, I was billed $5,000 from Tempest, saying your insurance didn't cover this because this is considered investigational. And my oncologist appealed. He even said that there was a contract between UCLA and Tempest, but it was reduced and I had to pay about $1,200 of it. But I think that information is valuable. I didn't have any biomarkers that they could really act on currently, but it did pick up on one mutation called the PIK 3CA. And it's found in a lot of cancers, but most breast cancers, I guess, express it as well. There is a drug called Piqray that's being trialed right now. So had I not had this test done, I would have not known about this obscure, I guess, mutation and this obscure medication that's out there on the horizon that, I don't know, maybe could be an option for me down the line. So I do think it's very valuable and important to have, because you do want to know all the tools you can use, whether it be the Opdivo because your PDL is high, or the Keytruda, or now Herceptin and HER2. There's just so many options available that you need to have that information. And whoever said you need to know your cancer, I think it was Rachel, absolutely true. You do. And I mean, not you yourself as a person, but maybe it's your caregiver, your spouse, or your mother. Somebody should have a general knowledge about like what treatments are suitable for you, what other options are out there, what are options are coming over the horizon. So, and I think things like that give me a lot of hope. I like to look to the future, and I think there's just so many interesting things happening that that we haven't been able to get to these outcomes with the conventional standards of line that we have now. So I choose to believe that there's a lot of good things on the horizon.
I agree with you. Okay. The boss says that we've come to a point where it's time to start asking for final thoughts and wrapping things up. So who feels the most ready to give final thoughts while listening to other people's final thoughts and chiming in? Rachel? Oh, I'm sorry. No, Suzanne. Suzanne raised her hand and I said, Rachel? And she's like, I'm not ready. Sorry.
Well, I just want to say that we don't talk about it a lot, but I think that it is really important that you're doing your integrative services. They've helped me a lot. I believe strongly in acupuncture. My cancer center has it, and I go every single week, and I 100% believe it's why I don't have the neuropathy that was getting pretty bad with the oxaliplatin. And I have, my herbs that I believe in strongly, and I do my meditation app, and, I try to eat, all of my superfoods and keep my diet as clean as possible, and the juicing and all of those things, they keep you stronger. And these treatments are really, really difficult, and anything that you can do to keep yourself stronger and feeling good, I think is really important. So I just like to say that.
Awesome. Thank you, Suzanne. Sorry about that, Rachel. Who would like to go next? Jason. I know you didn't raise your hand. I'm just.
All right. Sorry about that. I was on mute. So, final thoughts. I think we kind of touched on so much important information today. Be your best own advocate out there. currently going through treatment or you've went through treatment, if something doesn't feel right still, I mean, it doesn't hurt to call your doctor, your oncologist, and, if you have to, start knocking on doors. Keep an open mind, right? I think it's very, very important that, we go into this and we stay in this optimistic. I know it's easier said than done, especially for us that have been through treatment or are currently going through treatment. But if we lose hope, then, what good is there out there? I think hope, goes a long way in our recovery and in our continually, treatment, that we can't lose sight of that. Like Camilla said, there's things that are constantly on the horizon. If you can, please join any clinical trial that's out there. I was part of the first ever Signatera clinical trial. And, now it's being offered to everybody. I think nationwide now, I could be wrong, but I think it's being offered. So if you're not aware of that, or if you're not part of it, please ask for that. And, just advocate as much as you can to anybody that will listen to you, whether it's family members or on the internet or in person or just having a casual conversation. I mean, you might save somebody's life. So I think that's it, Tom.
Thank you so much, Jason. Great stuff. Okay, Irasema. I'm just calling on you. I hope you don't mind.
Final thoughts. I think that it is important to allow yourself some grace. I will agree with Suzanne that it's important to make sure that you're staying on top of like everything. Your vitamins are all crucial to having the right energy to keep fighting. I think if I can say anything to anybody currently in treatment, it's obviously we know it's not easy, and you're going to have a lot of bad days, but I think you need to have bad moments and try not to live in them long, right? There's moments in time going through treatment where you feel like I can't do it one more day. And maybe just have that bad day, but you got to wake up the next morning and think, start all over again, right? You allow yourself to have those bad days, but don't live in those bad days for too long. And know that you have a million people, who are here and fighting for you and just wishing you all the best. We're all out here. We're here to support you any possible way and help you guys get through all these good days, bad days, to cheer you on, and to lift you up when you need lifting. So thank you, Tom.
Awesome. Thank you. Thank you. Okay. How about Rachel? Are you ready now?
I'm ready. I would say that I think that it is so important to have your support system. You need to have a team of doctors that you trust and they're on your side. You need to have people in your lives that can help support you at home as well. I think it is so valuable to have good communication with your health team. Going through treatment is hard. There's a lot of side effects that you may be dealing with. They want to know about that. That was something I was told early on, that a lot of patients don't communicate the side effects that they're having because they just expect to feel bad. But there's a lot that the doctors and the nurses can do. They can adjust medications to help you through that. You don't have to be miserable. So communicating with your team a lot is something I recommend highly often. And then also just have good days. Remember, if we're fighting for our lives, we want to have lives worth fighting for. We want to remember the good and the positive things in our lives that are motivating us to fight. There are really hard days. There are really hard times. But, try to look for those moments of joy, the things that bring you happiness to help keep yourself motivated. And then look for resources. Like this is a great example of a great resource. There's other webinars out there. There's support groups. There's a lot of information out there. And so I think just really building that system of support for yourself is really important.
Thank you so much, Rachel. And Mrs. Camilla Rowe, final thoughts?
I think everybody did a pretty good job of covering the final thoughts. I think just like a reiteration from before, you know, everybody's journey is so different and what we need as an individual is so different. I even tell people, there's a lot of support groups out there. You find the one that's the best fit for you because each one could operate a little differently. The members might be a little different. So what you need to kind of have that customized. The same thing with your care team. The one thing that I wanted to mention when people were talking about just tips and stuff were, as far as scheduling goes, I would want to talk to the scheduler before I left the surgeon's office or the doctor's office. Usually they say, you know, we'll give you a call in a couple days next week. We'll schedule it up. And I said, no, is it okay if we just talk now and look through the schedule? I feel more comfortable if I have a time and date now. Doesn't always work, but it's worked for me a couple times, including when I had to schedule my total gastrectomy. So I do encourage you to try to talk to people face to face if at all possible.
Yeah.
And yeah, to not lose hope, to savor the small, simple moments in life, and hold on to a little bit of positivity because, you know, the body will, I really believe the body follows what the mind wants to do.
I love it. Okay, Camilla, thank you. Rachel,
Thank you.
thank you. Suzanne, Jason, Irasema, thank you guys all. I'm going to reiterate this that we touched on at the very top, and that is Rachel, Facebook is the best spot to communicate. Camilla, Instagram or Facebook. Suzanne, Facebook. Jason, Instagram. And Irasema, Instagram or Facebook. Thank you guys all so much for sharing your stories, for being the inspirations that you are. You're true warriors, and the sharing of your stories, I think, is going to help a lot of people. So hopefully we can do this again. And thank you all so much.